Historical development of hospitals. First, what is hospital? According to WHO definition, a hospital is an integral part of social and medical organization, the function of which is to provide for the population complete health care, both curative and preventive, and whose outpatient services reach out to the family and its home environment. The hospital is also a center for training of health workers and biosocial research. Actually, hospital provides curative, preventive and promotive services. Hospital provides care to the patients through its outpatient and inpatient services. Training of different types of health workers like doctors, nurses and other paramedical staffs is also done by hospital. Now, the types of hospitals. We can divide hospitals into 10 different categories according to ownership and control. According to ownership and control, hospital can be divided into public hospitals or government hospitals. Voluntary hospitals are driven by different charitable trusts, nursing home, corporate hospitals which are governed by different corporate houses. Next is according to directory of hospitals, that can be government hospitals, rural hospitals, hospitals which are situated in the rural areas, specialty hospitals which provide care to the specialty services like heart hospital, eye hospitals. Next is teaching hospitals, provides teaching facilities, isolation hospitals which provides care for different infectious diseases. Next is according to system of medicine, it can be divided into allopathy, Ayurveda, Unani, homeopathy. Next is based upon gender, hospital can be divided into male hospital and female hospitals. Next is according to the size of the hospitals. It can be small hospital, medium hospitals and large hospitals. Small hospitals means less than 200 beds. Medium hospital can have bed strength from 200 to 500 beds. Large hospitals have more than 500 beds. Next is according to clinical basis. According to clinical basis, hospitals can be general hospitals and specialized hospitals, provide care to the specialized services. According to the level of care, hospitals can be divided into primary care, secondary care and tertiary care. Next is according to teaching facilities, hospitals can be divided into teaching hospitals and non-teaching hospitals. Next is based upon accreditation. Hospitals can be accredited hospitals, means quality accreditation, or non-accredited hospitals. And based upon length of stay, hospitals can be acute care hospitals or chronic care hospitals. Historical development of hospitals. In previous days, treatment was associated with religious values or religious services. Priests helped the people in treatment and also helped in boosting up mind and the body. As diseases were in the community before human civilization, so medicine and surgery are also the oldest subjects. Medicine was first used in Mesopotamia before 4000 years. The first doctor's prescription was recorded in ancient Babylon. Natural causes of diseases and importance of healing by rational methods were recognized in Greece. Personification of the rational approach in case of treatment was used by Hippocrates, and surgeries was also performed by him in 480 BC, that is before Christ, and he also maintained detailed medical records. Islamic civilization first developed hospital. It was an excellent contribution. Islamic civilization also first developed asylums for mentally ill patients. After that, asylums were founded in Europe. In Middle Age, many hospitals was constructed in Europe. European Pope urged Christian population to donate for new hospital building. Royal College of Physicians have started to give license to London doctors in the year 1518. After that, the Middle Ages is known as the period of great hospitals. At the time of Renaissance, that is 14th to 16th century, many medical colleges were developed. In Germany, in Central and Eastern Europe, schools of medicine was started. In the period of Renaissance, management of hospital was improved. This period is also known for segregation of patients by illness. Then we will discuss healthcare in the 17th to 19th centuries. Scientific revolution was happened in the 17th century. This age was a turning point in the history of medicine. Continuous circulation of blood within a contained system was proved by William Harvey. It was century's biggest achievement. Microscope was invented. Vaccination was invented in the 18th century. As per research and learning, hospitals were classified. Modern medicine was first invented in 19th century. Florence Nightingale first started the concept of professional nursing service, which was the most important contribution of 19th century. Professional nursing has given emphasized on institutional treatment, human treatment. In 1860, first school of nursing was founded by Florence Nightingale in England. Bacteria as a cause of disease was another remarkable innovation. Father of bacteriology, Louis Pasteur, invented the bacteria were produced by bacterial reproduction. The National Health Service was formed in the UK in the year 1948. The centers of excellence where the best researches were started to move from voluntary hospital to the medical colleges. Modern hospital provides care to the sick patients, and medical education as well as practical hand-on training are given to the medical and nursing students. The health professionals can gain knowledge regarding health spectrum of the community. Modern hospitals also help the medical practitioner in continuing education, and hospitals will serve as a higher education system for the community. As per definition of WHO, modern hospitals will also provide studies regarding investigation sciences and biomedical research. Now, historical development of healthcare in India. In India, hospitals were established during ancient times. King Ashoka built good hospitals in India. In India, foreigners have brought their own system of treatment. Hakim was introduced at that time. With the European allopathic system of medicine or modern system of medicine came in India in the 16th century. During British rule, many hospitals were constructed in India. In 19th century, medical training was started. In Vedic period, Aryans were all well known for their own medical knowledge and religious belief. 4 Vedas are known as source of knowledge regarding Aryan culture, medical knowledge. As per Indus Valley culture, physical and mental health were the part of positive health. Ayurveda denotes science of life. Ayurveda discussed about the process of prolonging the life. Next is Buddhist period or ancient period. In the Buddhist age, Lord Buddha have shown interest regarding medical science, and he was also practicing medical sciences. He provided care to the sick. Lord Buddha have created Buddhist Bihar to provide care to the sick. In Buddhist Bihar, medical education was also practiced. In post-Buddha and Muslim period from the 10th century, Middle East physicians were practicing Unani system. This Unani system had its great impact regarding cure of sick. Many hospitals were established in India during King Ashoka. Next is Christianity and medical care, that is medieval period. In the Christian period, the hospitals were controlled by the church. Medicine was practiced as a part of religious services. The priests and nuns were well trained to provide care to the sick. Next is, and the last period is modern period of medicine. Royal Hospital was founded in the year between 1510 and 1515 by the Portuguese. After that, British and French established hospitals in 1668 and 1664 respectively. The medical college was started in the year 1846 in Calcutta. Local government were encouraged to establish the subdivision and district level dispensaries during the British rule. The sciences like parasitology, bacteriology and pathology were practiced at that time. The research regarding organisms helped to know the causative organisms of different diseases. At that time, government has taken some landmark steps in health administration, like the appointment of Royal Commission in the year 1859. In the year 1985, 1250 hospitals and dispensaries were there in India. Thank you.